Medical students are under enormous pressures, and that can impact their mental health. Fortunately, mindfulness can help with that. Hi, my name is Ted Meissner. Welcome to Mindfulness Voyage. If you would, please do tap that subscribe button. And today we're going to be discussing new research that helps medical students in Brazil with their mental health. Our guest today is Vinicius Vieira Neves. Vinny, welcome to the podcast. I am so glad to have you here. Thanks so much for your time today.
Thank you so much for having me, Ted. It's an honor to be here and share a little bit from my heart, how the experience was and what I love about mindfulness.
Yeah, that's great. And we're going to unpack all of this stuff, but I want to get started by first having you say a little bit about who you are, what you do. You just moved, for example. So tell us a little bit about that.
Yeah, I've been moving a few times in my life actually, but this is a different one. This is a big move. I'm a physician from Brazil. I've graduated in 2018 from med school, and I moved to the UK for a master's in health psychology, where I studied the effects of mindfulness. I was supposed to study that, but then COVID hit in cardiac rehab, and I ended up doing spirituality and cardiovascular risk, which is a lovely topic in itself. Over the UK, I did training as a mindfulness facilitator with Breathworks UK, which is specialized in chronic disease management and pain management. Um, then I went back to Brazil, worked in cardiac rehab for a while, and opened my own integrative medicine clinic, while doing a fellowship with the Academy of Integrative Health and Medicine here in the US, an online program. Um, and also got certified as a lifestyle medicine physician with the British Society of Lifestyle Medicine. And that ended up in 2023 when I decided to start the residency preparation for medical residency here in the US. I did a rotation in UCLA in integrative health, which changed my whole panorama about uh, career in mindfulness and integrative health. And yeah, I've been doing the USMLE steps exam since, and now I'm here collaborating with Professor Eric Laux and Professor Judd Brewer from Brown. I just moved for my role as a postdoctoral research associate here at the Mindfulness Center, and I'm looking forward to contribute all things related to mindfulness.
Yeah, thank you so much for that. And I want to ask if it's okay. You mentioned at UCLA having a big perspective shift there. Are you willing to say a little bit more about that?
Yeah, absolutely. I mean, it was one of these um insight moments you have, like when you just feel that things your heart feels in the same pathway. And I think one of the physicians, I don't even like had a lot of contact with her, but she told me a quote, I think it's from Bhagavad Gita, and some people do it to Jack Kornfield, likely in his books, which says, trust the unfolding of life. No, sorry. Meet this transient world with neither grasp or or uncertainty, something like that. Trust the unfolding of life, and you'll attain true serenity. And I heard that, and it still gives me a little bit of goosebumps. Like I heard that at that time, and life was unfolding for me. Everything was showing me that the US was the direction. Um, then I came to Brown, met Judd at that time, got in touch with Eric. Life was unfolding. I just needed to trust it. And after a two and a half year the leap of trust, and now I'm here. So
Wonderful. Well, welcome to this area of the country because it's now an East Coast type of climate. It's a little different than we have on the West Coast. And today we're going to be talking about research around medical student mental health. And I'm wondering if you could say a little bit about what interested you in even designing this research in the first place? Why did you want to study mental health for medical students?
Well, I think that's a bit of the me search that Judd also talks about, and a little bit of selfish. I want to study myself, you know. Back in 2013, I think it was like my first year of medical school, and I had a very atypical appendicitis. Um, Very typical symptoms. It was kind of hard to diagnose, so it took a little bit. Like it's usually a very simple case. Like if you have a pain on the right side, and then you go to surgery on the same day, and you're fine. You're back home the next day. Well, it took me 3 days to diagnose because it was atypical, and my appendix burst. Um, and I was in that special moment in medical school that you have all the knowledge and no experience. So I knew all of the very tough and severe complications that I could have, but I had no embodiment of medicine to trust that none of these would happen. So you can imagine what happened. I developed illness anxiety disease, and got into that's where I started psychotherapy and meditation with the Headspace app. And that's what saved me, to be honest, because it was very hard to trust my body after having atypical symptoms for a very typical disease. I created a catastrophizing habit of every different sensation that I had, I would catastrophize, thinking, no, that's a severe disease. So mindfulness did save me, and psychotherapy from going down that habit rabbit hole and actually leaving medicine, because I felt that the more knowledge I had, the more food I would have for catastrophizing, and at the same time I would need to hold that with awareness and patience to know that my medical skills would be built, um, to embody medicine and know that these catastrophizing habits, I wouldn't need to trust them and listen to them. So I knew medicine was at the same time my is a double-edged sword. It was my disease and my cure, and I had to have patience to let the medical skills be built.
Yeah. And it's interesting how the physical health issue can lead to mental health issues.
Yes.
It's an interesting, and I like the way you describe that as a rabbit hole, is there's a trajectory that a habit can very quickly form around catastrophizing. And I'm so
Yeah.
glad that you found a way to like, notice that. Not going down that road.
Yeah. Yeah. Yeah.
Well, tell us about this particular research that you did about medical students in Brazil, and what was intervention and what did you find?
Yeah. So after I had that, and that was in first year medical school, but I did create, I think in third year, a interest group for spirituality and integrative health, and we used to give lectures about several different integrative practices, and I chose mindfulness as mine for some reason. The universe was already putting mindfulness in my pathway, and I felt that this was the perfect um, secular intervention to put into healthcare. And when I arrived in my final medical school years, where I had to do a dissertation, um, I just felt that I could try to run a program. And these teachers that I met when I did a psychiatry rotation, one of them did this mindful intervention with the mindfulness-based health promotion program, which was developed in Unifesp by Professor Marcelo Dermazo in São Paulo.
I was going to ask if you knew Marcelo, as I was thinking
Oh
as
yeah,
you were speaking. So he's been a guest on the podcast as well.
yeah, yeah. Oh, that's good. I'm looking forward to watching his episode. Yeah, he's a co-author of the paper as well. He's a fantastic human being and researcher, and he developed this program, and that was the opportunity we had because the teachers were there. They introduced me to him as well, and we like, why not? Let's do it. We have a lot of medical students interested because we had members from the interest group. were asking about it after I gave lectures. So I felt like, yeah, we can offer the program. So why not do it a research as well and see what we can find? So it was like we call it like an opportunity sample, but also like let's see if it's feasible and if it has some preliminary effects on what we're looking for, because I know there are a lot of diseased people in this medical school with very high levels of anxiety and depression and low satisfaction of life.
Yeah, and I know from other research the idea of that stress, depression, anxiety, those typical triple punch of difficulties that people can have start as medical students, and they're actually already reaching high levels of depression and stress and anxiety by the time they get to their first rotation. And so getting
Yeah.
with medical students is wonderful to be able to do that. So can you say just a little bit about what the intervention was, and then what were the results? What did you find?
Okay, so it's a good point that you mentioned that medical students are a very vulnerable population in that sense, because we do have well, I'm not a medical student anymore, but medical students do have higher levels of anxiety compared to age matched samples. And I know from my literature research that if you develop a disease in medical school, like I did get a type of OCD, illness anxiety disorder. The likelihood that you're gonna need treatment after you finish medical school are very high. So that was one of the curiosity that we have. So maybe if we intervene during medical school, we can reduce those chances. Um, and we found the MBHP program it's an adaptation of the MBSR. So there's a little bit of mixture with the uh, MBCT as well. Some techniques they use, they put a little bit of loving kindness more explicitly than the MBSR. But in general, it's an 8-week mindfulness intervention. There's no retreat to make it more feasible for our population, but there is a silent day, like week 7, something like that. But in general, it's a standardized and recognized mindfulness-based intervention. Similar to the traditional MBSR. And we did find that, first of all, it was feasible because it's a pilot study, so feasibility study is our main outcome. Let's see if medical students can do this, you know. And we had some specific challenges from Brazil, like is it feasible to have medical students here until late at night in Rio de Janeiro, which is it's a kind of dodgy city. Will they stay here or will they? No, I don't want to. And well, we didn't have any other time because medical school is like full time. So that's one of the feasibility questions we had. But 100% of the participants that enrolled um, did finish at least 50% of the program. So I think it was small, so we cannot generalize that, but the 13 people we had, they stayed until the end.
Right. And what kind of results? Because I did read your a number of the different instruments that you were using. I've used some of those myself, but you used a blend. I had several that included the FFMQ, but you didn't just do mindfulness measures. You
Yeah.
also did measures on depression, anxiety. So say a little bit about that. What were those results?
Yeah, so we were a little bit impressed, and of course, this may be because it's a small sample and we had high levels of anxiety, higher than usual. Like I think we used the GAD-7 for anxiety and PHQ-9, very traditional instruments. And I know that there's some cutoff for, like, if you have higher score than 10, you may have a disease. And we had like 80% of our participants at baseline had more than 10 for anxiety, 60% had for depression. So we know we had a biased sample, and maybe that's why the results were very impressive, because by the end, We had a very significant reduction on anxiety and depression levels. I don't remember by heart, but something around like 50% and 60% for each. Um, and and yeah, these were the main results. Of course, these are exploratory results. It's just for generation of effect sizes to power a more powered study, but still, it was good to see um, how the students related to that and how they felt afterwards.
Yeah, and that last bit there is so important about why this work that you're doing is important in finding ways to help medical students and people in other very busy, high stress professions find ways to not just cope, but maybe even thrive in the
Yeah,
difficult
yeah.
careers that they've got. It's not, yeah, we did this intervention and they're good. It's like, yeah, and that impacts maybe the rest of their lives too.
Yeah, yeah, yeah. Not even just surviving, but flourishing. And that's, we actually did measure also like satisfaction of life, which was like a measure of flourishing that I wanted to see. But we couldn't interpret the results. Something about the questionnaires needing to be sent to the original creators to interpretation, and we didn't have the funds. But yeah, that's the intention. I'm completely aligned with you. The idea is not only to survive med school. Hopefully, we can flourish, and that's a very important time in an individual's life to also develop those skills to not have too much empathy suffering and how to be compassionate towards your patients, and you know the benefit is not only for yourself and for your flourishing, but also for the flourishing of your patients. We have studies showing that the more mindful clinicians are, uh, the more their patients benefit, whether they know or not your clinician is a mindfulness practitioner.
Yeah, the outcomes for patients is that's already, as you said, research that exists as well as reduction in medical errors and all the rest of this.
Mm.
So healthcare system should also be very much on board with having this kind of training program. And at its base level, if you're a burned out wreck by the time you get out of medical school, you're probably not in the best shape to be starting a medical practice as well.
Yeah, yeah, yeah. If you're hopeless about the system and about yourself and detached with a lot of callous towards patients, it is hard. Yeah.
Yeah. Now, I also wanted to touch upon something else. You had mentioned before we started recording the session today that there's some other kinds of research that you're getting involved in, and I wanted to hear more about that and for you to be able to share that here.
Yeah, absolutely. Thank you for the opportunity to talk about that as well. So I have these passions on the mindfulness field, and the mindfulness for healthcare practitioners is uh kind of a selfish research, like a me search, because I'm going into residency hopefully after the postdoc, and I want to have those skills myself, and I've been building for that. Right now, I'm collaborating with Dr. Leah Antico, which is the co-author in this paper, and Professor Judd Brewer on the development of um, um, very short intervention for clinicians and burnout, which is, in my opinion, I was one of the guinea pigs myself. Is a fantastic intervention in the way Judd sees the habits being formed in the healthcare setting and how we build empathy fatigue without even knowing. So how we have to be aware of that in our day-to-day life. So that's one of the passions, and I'm super happy that I'm collaborating with that because my other role doesn't allow me to have the wings on my sail for to lead this research. But always happy to collaborate on the field and for also for myself and for my future patients. How can I maintain um, myself healthy um, and not be seduced by the healthcare system that's That's a top topic before we move. And you mentioned about that, and I'm happy I remembered that. Um, I did a few rotations here in the US with integrative health medicine practitioners who left completely the system and built their own practices. And they said they're very convinced that like 80% of burnout is from the system and not from individuals. And that's a very important topic we mentioned in this paper, and Leah also mentioned it in a paper we're soon to be published, um, about not focusing only on individual interventions so that we don't send a message that the individual is broken and that's the individual who needs to be fixed through mindfulness. Um, and what I mean by being seduced by the system is that a lot of medical schools and hospitals now offer these interventions, maybe in a way to say that, yeah, we're doing things for the physicians and for the healthcare clinicians, but are you changing the work hours, long work hours, and the shifts? And are you changing institutional aspects, or are you just offering that to pretend that you're doing something when in the end you're kind of blaming the individual again? So, yeah, that's a huge passion I have, and I'm looking forward to seeing how institutions will collaborate and change their own perspectives as well.
Yeah, and I think you touched upon the main reason why wellness programs don't do well is that they address one thing. They hold the individual, the staff member responsible rather than the conditions that they're in. And if those
Yeah,
conditions don't change, it doesn't matter how many wellness programs you do. It doesn't matter how much time you sit in meditation. Those
yeah,
problems are still there. And that needs to be at the heart of any program that's going to change the experience of burnout, whatever the workplace happens to be. So thank you for bringing that up. And
yeah, yeah.
eager to talk with you more about all of that in future episodes. But for now, those of you who are watching or listening to this podcast, know that I will have some links for you, YouTube that Vinny has, as well as links to other aspects, including some research on this. Our guest today, Vinicius Vieira Neves. Vinny, welcome. Thank you so much for being here. Really appreciate your time today.
Thank you so much, Ted, for having me here.
Thank you so much for being here. And as a reminder, if you would please tap that subscribe button, share this podcast with others. It can help a great deal. Remember, every moment you have a choice. Make it the best you can. And I'll see you next time on Mindfulness Voyage.